The area of gynecology, pediatric diseases and experimental surgery includes 8 research groups. The spine research group, which I'm leading, divide our work in 4 main research areas. The first one is adolescent idiopathic scoliosis. In 2013, has generated very relevant information in the field of body image perception and has created a new scale. Our second research area is adult spinal deformity. Since 2010, is leading the unique European multi-center and prospective database for adult spinal deformity. Secondly, we are assessing all preoperative complications and risks in adult deformity surgery to produce an algorithm for surgical treatment. Our third research area is now running a trial to compare mesenchymal stem cells immobilized in bone allograft versus autologous bone graft in spinal fusion. And then our anesthesiologist group, and the main goal of this area is the identification of patients at risk and development of guidelines to prevent allogenic blood transfusion. The Musculoskeletal Tissue Engineering research group, led by Dr. Mario Aguirre, they are running 2 preclinical studies and a clinical trial about cell therapy with autologous adult stem cells in osteonecrosis of femoral head. The Bioengineering, Orthopedics and Surgery in Pediatric group is led by Dr. Cesar Garcia Fontecha. Their experimental studies in fetoscopic approach for intrauterine myelomeningocell repair have allowed them to be more translational, and they already started this treatment in the human fetus with good preliminary results. In 2013, they also developed a new animal model of skeletal muscle injury. Finally, they developed another animal model for pharmacokinetics in rabbits, which allow them to study the penetration of antibiotics in the infected immature bone. The general surgery group is coordinated by Professor Manuel Armengol Carrasco. The group received 2 new grants that have been awarded from national calls to further investigate the molecular basis of incisional hernia and new surgical procedures for low rectal cancers. The group has also published its experience as a European Center of Excellence in bariatric surgery. A patent has been obtained related to surgical suture instrument for anastomosis of digestive tract. New international networking has been started with the Max Planck Institute for Intelligent Systems and has been recently recognized as consolidated by the Catalan government. The Genetics Research Group is led by Dr. Alberto Plaja, and the group is evaluating the impact of the fetal alcohol syndrome spectrum disorders in a population of children coming from international adoption in Spain. They are exploring the frequency of genomic rearrangements and the causality for congenital heart disease. They are also collaborating in specialized and multidisciplinary clinics such as Marfan-Williams syndrome, fetal medicine, and short stature clinic. Finally, they have a bioinformatic and technical project to facilitate interpretation and lower costs of array CGH technique. The Maternal Fetal Medicine research group is led by Professor Cavero and Dr. Elena Carreras. The most prominent task of this group has been the international diffusion of the use of the pessary as a useful tool to prevent preterm birth. They are also working on the relationship between angiogenic, anti-angiogenic factors, misbalance, and nuchal translucency and congenital heart disease. The new Technologies and Microsurgery in Craniofacial Surgery group is led by Dr. Vescos, focused on the development of new image technologies, virtual planning, navigation, and robotic surgery, together with the development of microsurgery as a reconstructive technique in cranio-maxillofacial surgery. And finally, the Ophthalmology Research Group, led by Professor José García Lumí, mainly centered on retinal vascular disease, including the physiopathology of diabetic retinopathy, physiopathology and treatment of retinal vein occlusion, and new treatments of retinal artery occlusions.